We're going to be looking at why sexual and reproductive health rights must be central in the development agenda. Like we said before, we normally look at other things when we talk about the development agenda. Where is your trade? Where is your economy? What are you doing for manufacturing? What are you doing for infrastructure? How often do we look at sexual and reproductive rights? And that's the conversation that we will have this morning. Dr. Walter Obita is the country director with Mary Stopes Kenya, and he is our guest in the hot seat this morning. Daktari, Karibu sana.
Thank you. Good morning.
Good morning. How are you doing?
Very well, thanks.
Fantastic. Good to have you in the hot seat. We'll be looking at some of these issues this morning. And before we get into it, CT, as you may know,
yes,
is in a different African country every week. He'll tell you where we are this week and he'll share today's proverb. And we would ask that you would give us your interpretation of the same.
Okay.
All right.
We are in the Republic of Malawi. Wisdom is like mushrooms that comes after you have finished eating. You've eaten, you're in the process of burping, and lo and behold,
mushrooms
appear.
And not the good kind. I'm kidding. Sorry.
Well, I would say that there is school fees in everything that you go through.
Oh.
Wow.
Yes. Yes.
So after going through part of life,
yes,
and getting to see the experiences out of it,
yes,
there is an output, which is wisdom.
Yeah. Which is wisdom. That's fantastic, I must say. Great to share your insights on that. And, jumping into our conversation this hour,
sure,
we're looking into why sexual and reproductive rights ought to be considered for any country's development agenda. But let's start off a little bit with Mary Stopes and the kind of work that you do before we then are able to make the connect why these rights then must be considered. Please.
Yeah, sure. Thanks. And as I'll start off with what we do at Mary Stopes, we generally champion the rights, reproductive rights of women, girls, boys as well, and men in this country. And overall, our goal in this country is to see how we can increase access to not only contraceptives across the country, but also to sexual and reproductive health services across the country. We offer our services through various service delivery channels. One is through our network of 15 health centers, which are across the country. And we have one maternity that is also within the city. We also carry out our work in partnership with the government. And it's at national and county levels, where we strengthen capacity of the different healthcare workers. We build capacity in terms of quality across the different service delivery channels. In the counties, we do also outreach services where we take services out to the people, so that they can be able to gain access and also offer the services as enriched services at these public health facilities. We also have commercial sales products that we do sell across the country that are related to maternal health. There's Mariprist, there's misoprostol, which is important in management of postpartum hemorrhage, which is one of the main killers of our mothers in this country at this point in time. So those are broadly the ways that we serve our people. We also have a way that we can reach out to the people by calling us directly through a toll-free line. It's 0800 72 0005. So if people also have questions and need guidance on sexual and reproductive health matters, they can directly reach out to us from wherever they are.
Right.
What are sexual and reproductive health issues?
Okay, good question. Let's even start with what is sexual and reproductive health?
You're asking me?
Yes, but I'll give you the answer.
Okay. Please go ahead, yes.
Answer on City's behalf, please.
So when you're talking about sexual and reproductive health, you're literally talking about matters touching on sexuality. You're talking about matters that touch on the reproductive organs of men and women, boys and girls, and you're also talking about the reproductive rights. On sexuality, you're talking about how can people have safe pleasurable and satisfactory sexual lives, how they can be able to plan whether or not to even have children, when to have them and how often. You're looking at matters touching on if they're on contraception, the different options that are available. You're looking at how to safeguard boys and girls and men and women from sexual gender-based violence. You're looking at aspects of those who have infertility issues and how to ensure that there is fertility. Those who have, those who can get sexual transmitted diseases. How do you prevent it and how do you treat them? How do you check on the wellness of our reproductive systems in terms of vaccines for cervical cancer? So it's really broad. So when we talk about sexual and reproductive health, those are the things that we are literally talking about.
So, Doc, we talk about sexual reproductive health in this country, but then again, talking about these matters in our setting, we know it has been a taboo to talk about these issues. So, yes, especially in rural communities, how do we ensure then that this entire conversation gets deep to even the rural communities in the country?
Okay, so there are barriers that we need to break, basically in matters sexual and reproductive health. Generally, that, as you have said, it's even a taboo to be discussing these matters in the home, in the community, which is part of the problem that we have. It has led us to have a higher increase, or rather an increase in adolescent-related pregnancy. We have abdicated this role to generally just people to speak about it along the corridors and not face it one-on-one with our children. And so in order to solve this issue, I think there are a couple of things that we need to do. First, be able to be bold enough to say that we do have a problem in terms of sexual and reproductive health. By being able to bring that out, then people start speaking out. The challenge that I've mentioned about our adolescent pregnancies, we generally have close to 250,000 adolescent pregnancies, or girls who have had a pregnancy within the age of 15 and 19 in that span of that age span. And let me tell you how that...
In what time period, sorry?
Per annum. That's
every
annual.
year. So essentially, every year, 250,000 young girls,
yes, aged between 15 and 19, and let me tell
are getting pregnant.
Yes, or have had a delivery. And let me tell you what that means. If you take our highways, let me pick one. So from Ombaso to Busia is about 950, almost 1,000 kilometers. And if you're having about 250,000 girls having a pregnancy, that means if you lined them up along that highway, then almost every 4 meters, you have a girl who has either had a pregnancy or is pregnant. That's how serious that issue is.
Okay.
Yeah, sure.
So I within that number, from information that you have, how many of these girls are aware, and I know it sounds crazy, but you'd be surprised, are aware of the process that took them from being not pregnant to being pregnant, or aware of the information around what their needs are when they are pregnant or have children?
Generally, I wouldn't know the exact number, but from our experience in the industry, there are not many, because some of them get to find out they're pregnant after probably they have missed 3 or so periods. So it was not an intended pregnancy. It is an unintended pregnancy. People are not talking about how to prevent these pregnancies, and our young girls and boys are engaging in sex. So most of them get to hear about these when they come in to the clinic or to a hospital and they say that I'm having these symptoms of abdominal pains, I've not seen my periods over some time. Some of them, they experience it when they're actually in labor. And that's when the first time they have an encounter with a provider. Some of them, they may experience it when they have a miscarriage, and they seek care at a hospital just because they're bleeding. So majority of them early in their reproductive ages are not getting access to this information. It's not openly being discussed in schools in terms of sexual and reproductive education. And so these are the outcomes that we tend to face from the society.
And are those rights, Doc? Are they rights? Is it your right to have access to this information when it then hinges on sexual and reproductive care?
Yes, it is your right. You have, first of all, you have the right to information. And sexual and reproductive health information directly impacts your life. So if let me give this example. So if you have a daughter and she is 16 or 17 out there, and her peers are engaging in sexual activities, and we have not done the right thing in terms of giving them information about what sexual education is, what sex really is, what it means to get an infection sexually that transmitted, what does it mean to prevent yourself from getting pregnancy at the adolescent age, what it means from a behavioral perspective. So it's not just the clinical side and the medical side we're talking about. There's also the behavioral side in terms of what we need to do to prevent these.
Doc, we talk about these numbers that you are stating here, 250,000 adolescents getting pregnant. But now let's tie that to, in terms of the Republic, the country now dealing with these numbers, because for any country to be able to deliver to its citizenry, there is a plan around it. Let's say, now here we're talking about unwanted pregnancies and whatnot. How would these come to affect development of a country or the country being able to plan for its citizens?
So as a country, we already have actual policies that have been developed to try and solve these issues. We do have a reproductive health policy currently in place, running from 2022 to 2032, and within it there are steps to start to plan and reduce this problem. One is to increase access to contraceptives across the country. Another is sexual education to be upscaled across the country. The other is to increase access to youth-friendly services within our public and private facilities. This was generally an issue because you would find youth going to a health facility, and there's a lot of stigma around them going to seek sexual and reproductive health issues. You would find them walking into a facility, and the first thing that when they say the services that they're seeking, the healthcare providers that they're seeking these services already starts judging them. Yeah. So youth-friendly services within our public and private facilities has been one other angle on the policy direction, and just generally increasing access to the services, being able to provide counseling from that perspective.
And is that changing? Mary Stopes, for example, young people able to come in and get information in a way in which it would be beneficial to them. Is that changing?
That is changing. I can tell you, even just looking at our data for last year, at least 1 in every 4 people who come either to seek services or to inquire for services from our call center is a young person. And this has changed over the years, because before that you would even have it as 1 in every 8 or 1 in every 10. So yes, there is interest from the young group, from the young population, to be able to access these services from a professional who they can call. And that trend I see is increasing over time. Yeah.
And we talk about the young people and the sexual health, and one of the things that one would then want to talk about is access to it, and we know where the young people are, which is on the internet, digital, and whatnot. So in terms of giving access to this to the young people, I mean, what are some of the innovations, technology, telemedicine, if at all there is, that Maina Stopes is putting in place to ensure that that access is actually granted?
Okay, very good question. So one is we have gone into the spaces where the social spaces where we have these young people interacting, and so we have active engagements with them on TikTok. We have active engagements with them on Instagram, Facebook. Not too much for the younger people, probably. This is the group that would be on Facebook.
Don't look at City.
I know.
He's on TikTok.
He's on TikTok. Okay, Tick. We have a call center, as I mentioned, that we can be able to engage. We do have a telemedicine platform where people can also make calls and get counseling or get a consult from a healthcare professional. And in terms of even just how we reach out to these people, we are now not only using technology, we are also having programs that go out to them to look for them and be able to speak to them either through our outreach programs. We are also not only just seeking to meet with them and solve the problems in terms of the sexual and reproductive health. We are also going further to try and see, for those who have also gone through these problems and have had teenage pregnancies, how we can also empower them economically. So we do have some economic activities that we are able to provide seed capital for, take them through how to grow their businesses, and they can be able to have some economic activities that they can be able to.
Could you give examples of specific activities? Some of the challenges you've had in implementing them, some of the successes you've had?
Okay, so we currently have one. Let me speak to the one in Homer Bay. I was even just in Homer Bay last week. And we have a group of young girls who we have been able to support to come together, who are who have gone through teenage pregnancies and have been able to come together to form a social group. We've provided them with seed capital to do poultry farming, and they're doing quite well. When we met with them last week, they're already having plans on how they can scale up their business by having hatcheries and being able to tap into wider markets. The challenge that we generally face in such activities is that we can provide some level of seed capital. As they also need to grow, they also need to have more financial resources, which we may not be able to provide adequately. So this is where now we also try to look for like-minded people to come and support. When it comes to financial literacy, they're not business people. Most of them probably dropped out of school because of their teenage pregnancy. So there's also the financial literacy and being able to meet that gap to know what is a business, what does it mean to grow it, how can I be able to scale it, etc. So there's a level of input we do provide, but definitely still room for improvement. We have been targeting, we have a program that is targeting about similar program, about 5,000 girls across the country. But when you look at the scale, that's probably just a fraction of the number of girls that need this economic empowerment activities to be able to move out of that hole of poverty, which is generally a cycle that you always get into once you've had a
And if you
pregnancy.
link it to sexual and reproductive rights, for example, how do we do that? I mean, I have an idea whereby you're saying that if you have something to do, which is giving you, some income every day or whatever, that the likelihood of then you maybe getting involved in sexual activity for money, because that's another reality.
Yep.
Are we saying that then improves on that scale, or how would you link the two?
I would link the two in terms of one of the reasons why you end up having this cycle is because you have a young girl who has dropped out of school. A young girl who thereafter has limited economic prospects, because again they have to take care of not only themselves but as well as their child. They are already dependent to the society because they are a child raising a child. Now, to be able to tie that to the economic activities, if you have a productive girl or a productive young woman in a society, that means she's able to not only provide for herself and her children, she is not primarily tied to trying to get into an early marriage so that she can get out of a cycle of poverty. So that again removes her from other pregnancies that would come during the teenage period or early 8 years of her reproductive age. You are able to take them through also some level of education. So some of them can actually go back to school, finish their either high school and get into other vocational training that can also build them out of this poverty cycle. So it is not that if you do have a teenage pregnancy, you are condemned into a future of either poverty or a future of uncertainty that you can't come out of. So what we try to do as Marriage Stopes is give them a head start in any way that we can, and then walk them through to ways that they can also come out and overcome the circumstances that they find themselves in.
So we talk about access to sexual and reproductive health, and that also ties in with matters to do with policy. So in terms of the policies that govern this area, are there policy barriers that limit or affect the access to sexual and reproductive health? And if that's the case, perhaps stakeholders like yourself, what are we doing to make sure that that is addressed?
Okay, that's a very good question. So, yes, we do have some policies that are a barrier to access. So, for example, you need to have consent from either parents to be able to provide a sexual reproductive health service to anyone below the age of 18. So what does that mean for our young girls who are 16, 17? We know they're engaging in sex or sexual activities, but they need to come to a provider and have consent given to them to access these services. Not only the consent part, you also have girls who, for example, or boys who are orphaned. So, and a number of them might not even have someone primarily taking care of them to give that consent. You find that another point, in fact, one of the policies, and it's currently in debate, is even whether to increase the age from 18 to 21 to be able to obtain that consent. So what does that mean for the other 3 years that you're trying to have consent be given to be able to access some of these services? The good thing about also what we do in terms of advocate for increased access is we also use literally data to inform what we are trying to advocate for. So in this circumstance, if when we don't have when we have, for example, the issue of consent, because I think that's the one I will post, you will find that because the young people are not able to access, say, contraceptive services or appropriate for their age, let me put it that way, they begin to use the wrong methods for contraception as they engage in sex. So you're seeing as though there's less uptake of, say, condoms around that age group. You have an increased uptake of the emergency contraceptive pill. Just last week, one of my colleagues was even mentioning that every Monday you can find pharmacies that are out of stock of the emergency contraceptive pill because they have just been consumed over the weekend. It's not the appropriate method of contraception for this group. You end up having an increase in sexually transmitted diseases, and as well as increased HIV cases. I think in 2022, almost 40% of new HIV cases were among this population.
When we look at the services being offered by Marie Stopes and other entities that are of a similar mind, it tells us there is a problem. And you can point to the school system, you can point to the curriculum, you can point to environmental matters, you can point to peer pressure, you can point to all those, but I was saying I'm pointing at the parents. There seems to be a problem there. And I also said that given that we are Kenyans, I must find someone to blame. So I am blaming the parents. Yes.
Doctor, who are you blaming?
I don't think it's a blame game.
Of course it is.
This is from many factors, as you have rightfully put it. So there's no silver bullet that if you shoot and you hit the solution on the parents and you forget about everything else, you're going to solve the situation. No, not at all. Because, yes, there's a role that parents need to play in terms of educating our girls and boys on matters of sexual reproductive health. There's the role of our government in terms of setting the right policies, legislation, and implementing. It doesn't just end at drafting, and implementing. We have a role of our education system where we need to also have structured programs to be able to educate our people. What we do what you asked the direct question, so what we do as Mary Stokes when it comes to our parents. In many of our integrated within our county-related engagements, we tend to have generational discussions with different groups of people. One is also with parents. And we try to give as much education as we can on matters that they can be able to try and also discuss with their children. What's interesting also within some of these conversations is that culturally, some cultures just don't are just not amenable for them to have these discussions with their children. And so pointing only at them and saying, if they did this, then everything else would fall into place is not necessarily
this custom issue and culture. It's an excuse.
Not really.
It is, because when it suits their purposes, there will be cultural issues that they'll simply ignore. When it suits their purposes, everything they are doing will be because of the culture. Cultural issues being an impediment, let me repeat, is an excuse. Because in many cultures, the idea of educating girls was simply not a done thing. You waited for girls to get married, you were paid dowry, and life went on. We don't do that. The culture in some places are still retained. They have the option of understanding why other people within their own community educate the girls.
True.
But some prefer to stick to what they think suits their purposes.
True.
Yes. So as far as I'm concerned, let's look for another reason, not culture.
Why is it easy, I guess? Because this is what we're talking about here, isn't it?
Yeah.
That this information must be shared, must be communicated, and it is not happening. At least not in the measure in which it should. Why is it then that it isn't? Because we have to look at that. Why is it that you just allow a girl, or a boy for that matter, because we must understand, in order for reproduction to take place, there have to be the two. The two. So both have or need the information. So why are we still so uncomfortable? Why do we just not share the information? Why don't we? Children are born at a minute every day? Every minute a child is born.
You are giving the example of the period when the AIDS pandemic was an issue.
Yes.
Yes.
Yes, we're discussing it offline. So the time when the HIV pandemic was an issue, and we had many people getting infected, dying of HIV across the country, one of the interventions were on multiple levels. You would find that, and let me start with the education part, because it really is one of the key areas. HIV education was structured into our formal education system. Those are the days when you'd have Tuju was very strong on communication at that time, and he put up so many awareness forums and videos to educate people on what HIV is, what sexually transmitted diseases are, etc., etc. There was a component to also change behavior in terms of if you're to engage in sex, what does it mean to also have safe sex? There were people were speaking about it openly because people were being touched by this directly, whether it was a relative, it was a brother, it was a sister, it was a friend. And economically, it was also impacting our nation. So the gravity of it was touching on every aspect of our lives, and people were also seeing that we do need to change. Indeed, we do need to change the trajectory of this infection. Now, coming back to our sexual and reproductive health, what you're asking, why aren't we also speaking to it as loudly? I think, in my view, it may not have touched people into that level of beginning to discuss it very openly. You will have people discuss it in social areas, but not openly. When it comes to even from our people in our legislature, not many of them will discuss this very openly. And these are the people who are supposed to shape up, say, our laws and regulations on how things should be done globally. So,
if we make the link, are we then essentially saying that folks who have a few more points on the development agenda are then more open about how they have conversations around reproductive and sexual health?
I would say yes, because it always starts with a conversation. When people are able to put their heads together to solve a problem progressively, that's where we start. If everyone is only speaking around closed corridors and we're not able to come and sit down and have an open discussion, then the engagement is already out of the room. So it starts with an engagement.
It's a bit of a conundrum because...
Isn't it, though?
Yes, it is. When you look at the population of this country and the rate at which it is increasing, people most certainly have sex.
Yes.
Now, why is it that we can discuss sex when we are thinking of having it or planning or coercing it, but when it comes to discussing other matters that relate to outcomes of that very same activity, we have an issue, and then we throw culture into it?
Or development.
Yes, and why must
Open
it be a
society.
discussion that we seem to only talk about when the lights are off and you're under a blanket? Why?
In the dark.
In the dark.
So, you've raised something that is very critical in terms of during when Tuju was big in communications, you'd find that was the policy and direction that the government had taken discussing this. But we seem not to be seeing the government do that right now, because the only other time you find even parents discuss matters to do with sexual reproductive health is at that time when women let down. I was expecting more from you, but it is a conversation that no one ever thinks of the aftermath of sex. Hence the reason why we need to talk about it before it happens, which is why.
In fact, he's partly answered your question quite well. We discuss more of it after the fact,
but
and not.
Do we discuss it in any constructive manner, really?
More often than not, after the fact.
Yes, but even then, if after the fact we discussed it constructively, then it will be a good discussion.
Yes.
But is it really the case?
No.
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 So that seems to be our problem.
Yeah.
Then
Yes.
that's how I see how we can link it to development.
Yes.
Because the same thing, whether we're talking about sex and reproductive rights, whether we're talking about implementation of other things, you have a plan, but you don't really deal with the thing until things have gone wrong.
Yeah.
We don't deal with it in the preliminaries. We don't deal with it in terms of sharing information. We don't deal with it in terms of being open and transparent. And then we have a problem, and then suddenly we want to deal with it. So how are we going to get to the point whereby CT gives us examples about, working with HIV and how they had to be very, very open about certain things. Otherwise, you cannot solve the problem. You will not be able to go forward if we don't. So that's the question. So, I have to throw in parents here as well, because you don't want to talk about anything with your children, but you want to talk about their math score, but everything else that involves this child, until they show up with a pregnant somebody or they themselves are pregnant, then you're going to say, oh my God, where did you learn this thing from? And who was helping you?
Yes.
But they've been in your house. Or where have they been?
One of the hindrances to actually HIV and AIDS communication and understanding it was actually the healthcare providers.
Yes.
It was found that they had issues with those discussions. Any discussion around sex, man, you could go around it and visit probably Egypt and then go back to South Africa, but to actually talk about it.
It's crazy. Even yesterday, somebody had to spell the word as though we didn't know what it was going to be spelled.
Yes.
Somebody had to actually say sex, and I said, for crying out loud, we know what it spells, right? But even then, you still you can't even say the word. How are we going to deal with the issues that come? We can't even say it. We still want to spell it as though we don't know what it spells.
It's so crazy, because even today as we sit here, there is someone who wants to go to a pharmacy to get a pack of condom, but they don't know how to ask for it. Nipatie ile kitu.
Hiyo kitu ni ngumu. The point you say, Lucozade, yes, Lucozade.
Until you wait, the entire pharmacy is empty. Then you're like, "Nipatie kitu." You still can't say what it is.
So how then do you debunk? How do we get away from this? Because it's an issue. If we're talking about 250,000, that's a lot of people. If we're talking about 250,000 girls getting pregnant or having children every year, because between 15 and 19, they are still girls. They're still children having babies. Somebody got them pregnant, and they are pregnant carrying children or having gone through the process of childbirth. How then are we having these conversations? Because we're talking towards a developed society. What conversations are we having? I know you're having big conversations around that this week, but what are we doing and what are we planning?
It's 40 years that Marie Stopes is celebrating.
Yeah.
Surely. That's enough time for, one to have figured out at least, because this is a continuing problem. If it didn't exist, Marie Stopes wouldn't exist.
True. And I think that's the day we are looking forward to, having a society where we'll not have any of these teenage pregnancies, none of our mothers are dying. But in order to reach that, I think there are multiple levels we need to think about. And there's work that we are doing in all those levels. One, there's at the community level. And there's work that leadership at the community with the community health promoters are doing in terms of getting this information out. If I use, let me say home, because I was in Homa Bay last week. They're doing tremendous work in that area. They're one of the counties that actually does have one of the highest rates in adolescent pregnancies. But what they are doing with the deliberate leadership all the way from the top is that you have the governor going down to the schools, to the community. You have the community health promoters within each of the community units, setting up barazas where they can have these discussions, have questions being raised. You have CSOs out in different counties advocating and speaking out to what needs to be done, not only at the community level, but also as parents and leaders. There is an aspect, as I mentioned earlier, on just being able to implement some of the sexual and reproductive health policies and laws that we do have in the country. We do have a role of strengthening partnerships between the public sector and the private sector. so that even you're able to cross-refer client girls and boys and girls, and women, between the two different sectors when they do need these services. There's an aspect on even our health workers. Not everyone can, as you mentioned, can discuss openly on sexual education matters, even with adults, not only our girls and boys. So there's also still room for these health workers to have capacity built around them. And then there's generally just the discussion about social behavior change around aspects on matters related to sexual and reproductive health. As I mentioned, it's not just the sexual component, but there's also the reproductive aspect around it.
So, Doc, how do we include men and the youth pretty much in this conversation? Because for a very long time, when you talk about pregnancy, you say that is for a woman to deal with. But then again, there is the other party that is involved. So how do we rope them? How do we rope the men in this conversation and the youth to just know these are some of the choices that I have when I'm engaging in sex?
Yes, and that's one of the lessons that came out when there was a strong drive to just focus on the girl child and the women, and forgot about the boys and the men. Most of our society is also patriarchal, so you do need to have the voice of the male in matters reproductive and sexual health. In some cases, you'll speak to a woman even about a contraceptive method, and she will tell you, mzee lazima apitishe ama yeye ndio ataamua. So yes, we encourage. Now what we've also learned from that, we encourage them to have these discussions together. Yes, it's true.
I know. I just the reality just hit me again that those conversations still happen. But please, sorry.
Yes. So I think there's a component where we also realize that actually sexual and reproductive health decisions are also they're supposed to be made also by both parties. So it's not just about the girl, it's not just about the boy. So also encouraging sessions where you do have both the girls and the boys, or rather in couples coming together and saying, these are your options. You can both discuss and decide what works for the two of you.
Yes.
When it comes to, as I mentioned, the men in this patriarchal society, once they also understand what it means on matters even from gender-based violence, when they understand matters on the importance of spacing even pregnancies. What that means to not only their family but also to their society, and then having them also champion others or the other fellow men in terms of being champions of sexual and reproductive health rights. So they definitely do have a role. Even from our general leadership, you have quite a number of our leaders being male. So if they also understand what their role is as leaders in this area, then you can also start getting advances in reducing this problems that we do have.
So what conversations, what activities are you having this week? In a couple of days, we're looking at, some things that will continue these conversations or put them on a broader scale.
So we are having discussions on some policy reviews that are currently ongoing on sexual and reproductive health. There are discussions on increasing resource allocations for sexual and reproductive health products included. Like, for example, a bulk of our family planning and contraceptives were primarily financed through USAID funds. What does that mean for us in the next couple of months or years? So there's that advocacy aspect we are driving. We are trying to see how to strengthen or to have inclusion of some of these services within the UHC framework and through social health insurance, because being vertical programs, they were not primarily put into the benefit packages of our social health insurance. So seeing how moving from vertical funding from programs to integration into our UHC framework for financing through our social health insurance programs. So those are just some of the conversations, and also just from our devolved perspectives, not only just at national level, just being able to have additional resources on sexual and reproductive health within the counties. At least so far we've had advances in that in Kilifi, in Kakamega, in Vihiga. So we are still pushing for increased resource allocations and also across the different counties, not only at the national government.
Do you see the conversation? Usually we say, well, the government has to do something. It's always somebody we can hop up to easily, but here I see this as something that it's got to be collective.
Yes,
because these are children, these are families, these are partners, spouses. That if we're saying that this is one item that contributes to the development of any country, then this is one thing through which everybody has to be involved, isn't it?
Sure, absolutely. So everyone has a role. Everyone absolutely has a role, and this is not the. This is not that call for serikali.
This idea.
No. The government has its role as a steward in this respect. They are the ones who allocate resources. They have that role, but also everyone else has a role, as I had earlier on mentioned. So I'm not saying that as a primary role. This is serikali. Idea as the silver bullet to solve this problem.
Yeah. But even as we say, this is not for Serikali's idea. Fact that funding stuff like condoms, the low numbers of availability of that, how's that affected access to this?
It does, and that's why I say it does have a role, very critical role, as I mentioned, as a steward, but it's not the only role.
Okay.
So we do have, assume we do have these. Products of contraception availed by resources, but if we don't have a delivery channel for them to be able to be accessed, then we do have a problem. If we don't have the education component of how they should be used, then we do have a problem. If we don't know where to access them, so even if they're available, then we do have a problem. And so each stakeholder has a role, be it public, be it private. NGOs, CSOs, individuals, parents.
Parents.
I still do think also it's critical and it's important that, people around the country can walk into a Mary Stopes and get information that they need, anytime. And isn't that the thing? That every day of the toll-free numbers, or even walking into a clinic and getting information about anything at whatever level, isn't it?
That is true. And our communication channels are either to our toll-free number, 0800 72 0005. We do have active WhatsApp communications with people who are inquiring. Walk-ins can come in, make inquiries on matters of sexual reproductive health, because also the service providers we have obstetrician gynecologists available. We have a whole clinical team who also carry out diagnostic services. We have a pharmacy that can provide medication that's required, and you can also get your counseling from there. We do have imaging services, so in case you also just want to come and find out how is my pregnancy going on, you can actually come in and we'll take you through your course of antenatal. So yes, we do have all these communication channels. We have flyers that we have also delivered, distributed, and we have them in our centers that can simplify this communication.
Yes. Fantastic. Dr. Walter Obita is the country director for Mary Stopes Kenya, has been here with us sharing vital and critical information. Thank you for the work that you do, and thank you for being in Kenya's biggest conversation this morning.
This is the Situation Room, the only way to start your day.